In this video, we're going to learn how to make a simple CDS query and notification. Start in Setup, Charting Setup, CDS Query Setup. We're going to create a new query and we're going to give it a name. For this situation, it's for Dr. Bonner's patients, and it's patients due for mammogram. At this point, while you're building the query, unclick Notify on Charts and Notify on Appointments because it is live in the background. Save the title, and now we're going to edit the query. So it's blank, so we need to add some lines to this query, and we always start with the demographic data in clients. So which demographic data are we going to choose? This query for mammograms applies to females over the age of 50 and under the age of 74. Now this is inclusive, so this includes patients age 50 and 74. It applies to females, so we need to check the box here. Since Dr. Bonner's the only provider that wants these notifications, so we're going to click Dr. Bonner. And in our practice, valid Alberta patients are our paneled patients. You do have some other options on this, this line of the query, including verified data. So if you only want to apply it to verified patients. At this point, we're going to save the line. We're also going to save the query. Normally, you'd also close it, and then you would, in this screen, run that report and look through your list and say, do I have female patients 50 to 74 attached to Dr. Bonner? If you don't in that first list, you made an error and need to fix it. So we did validate, and we are certain we have females 50 to 74 attached to Dr. Bonner, so we're going to add a second line to our query. We're going to look in scans because that's where mammograms are in the practice. So our next line is going to contain scans. Now this is where you're going to realize how important it is to have good scanning protocol in your practice. And in our practice, every scan called diagnostic imaging has a note containing mammogram if it has a mammogram in it, because we know that DI reports may contain mammograms, breast ultrasounds, and sometimes bone densities as well. But our protocol is when a mammogram comes in, it's scanned under the scan type diagnostic imaging, and the word mammogram is attached to it. We also know that mammograms are due every 2 years, so we're really looking for those, first of all, that have had or not had those mammograms in the last 2 years. So at this point, you have to save your line. You're going to save the query. Normally as well, you're going to close the query and run the report. And you're going to look at that list and you're going to say to yourself, did I find Dr. Bonner's female patients 50 to 74 with a mammogram? You're going to click on a number of patients, look in their scans, and validate that you found patients with mammograms. Once you are certain your query is correctly identifying those that have the mammograms, while we're on this line of the query, you're going to change it to not. So now what the query is going to do is it is going to identify those patients that have not had that mammogram in the last 2 years. These are the patients that are due. So we're going to save our work, close the query. At this point, yes, you would run the report and validate the query, and that you would look on the list and say, are all these women due for mammograms? Once you've done that validation step, then you can, as per the team's choice, click Notify on Appointments and Notify on Chart. And that notification will appear to identify patients that are due for mammogram.